But when the patient comes in, it's very interesting because now oftentimes what's accompanying the patient, especially these athletes or such, there's video. There's video or there's a camera or a photograph that shows us something of the injury. For us, it's about looking at the part of the body that's been injured and how it occurred. From that, it's you start to go through deductive reasoning about what could potentially be here. And then it comes down to an x-ray to look for overt things that are either broken or out of place. That's the pretty easy part. The more difficult part begins when you know that something is injured and now you have to go through a detailed clinical examination to try to figure out what structure or structures is injured and to what degree. Because ultimately what we're trying to do with these individuals that still want to compete is try to determine the severity of the injury and the optimal treatment. But the question always from the athlete or the coach or the agent or the parent is, when can they play? That's what they always want to know. So it's very important for us to always try to figure out, again, the severity of the injury, optimal treatment, and also optimal return to sport. But it doesn't mean that some injuries can't play with soreness or difficulty. As long as we know that the injury is not going to continue to cause them further injury or put them at risk or harm them, you can play with some pain on some injuries, but we have to protect against it. So we have to be able to make a real accurate diagnosis and try to be able to assess those injuries that we can actively treat and let them participate without further harming them, because what they need is time to heal. So yes, you can play with some discomfort and we can seek to manage that. So there may be I think I have a basketball player now from one of the universities that they developed stress fractures in. Well, the stress fracture in a lot of cases would pull them out of the game completely because we don't want the bone to break. Well, what we can do is we can modify things. We can put them into a protective boot walker and get weight off the foot all day long, so these inconsequential steps through campus all day don't count as load on the foot. And then to keep them in shape, we can put them on a gravity type treadmill, which removes 50 to 70% of their body weight so they can still run. They can still run and keep themselves cardiovascularly in shape. Then the athletic trainers are working with them and keeping their muscles in shape. And then we can get them back on the floor to start practicing that 1 or 2 hour of game and then back to protection so the body is healing itself. So no longer are we just in this mode of, you have this injury, you just have to stop playing until it stops hurting. No, our goal is to try to be able to keep people in the sport safely and help their body heal along the way. So that's what we try to do.